Good afternoon. Okay, so Laura asked me to do an example of a case scenario, and she specifically asked for number 6 in your Chapter 8 homework. So that's what I've done here. I've just copied this, I've typed it out here so that we can, work on this together. Okay, so this is a whole lot easier than you're making it out to be, and I think you'll see when we get to it, okay? So, the first thing we're going to do when you get a case study or a case or anything like that, we're going to read through it once. And this is not necessarily what you'll do once you're a seasoned coder, but you're just starting out, okay? So, the first thing we're going to do is read it all the way through. So, the patient was admitted for prophylactic breast removal. The patient has a strong family history of breast cancer and fibrocystic and severe fibrocystic bilaterally. The patient was taken to the OR and bilateral simple mastectomy was performed. The patient recovered with no problems. The pathology report showed no evidence of malignancy. The final diagnosis is family history of breast cancer and severe fibrocystic disease, and the procedure was a bilateral simple mastectomy. So, how do we tackle this? Well, what you need to do is, you need to remember that we have to capture everything that we see, everything on that record. All right, so in this case, we've got to capture everything that's in this little scenario. Okay, so how do we do that? Well, number one, we're going to write a couple things down here at the bottom of the page. So the first thing we're going to do is we're going to write diagnosis, or DX. Okay, and then here we're going to write procedure, or PX. Okay. And that's going to give us a little place to write what we're reading. So, anything you come across, sentence by sentence, we're going to write down. Okay? So, for instance, the patient was admitted for prophylactic breast removal. Is that a diagnosis or is that a procedure? Well, in this instance, it's kind of both, right? Because it tells us it was prophylactic. And you'll understand that when we get into this a little more. But we're going to write it down under our procedures. So we're going to write breast removal, prophylactic. Okay? So that's taking care of sentence 1. Sentence 2, the patient has a strong family history of breast cancer and severe fibrocystic bilaterally. So, first thing we've got, family history of breast cancer. That's a diagnosis. So we're going to put that over here. Family history, breast cancer. Okay? So now, so far, we've gotten rid of the breast removal. We've gotten rid of the family history of breast cancer. Now we've got to look at severe fibrocystic breast disease bilaterally. So we've got fibrocystic breast disease, severe, would help if I could spell, and it's excuse me, bilateral. Ooh, it is that time of year. Okay, so now we've gotten rid of this. So now we have that the patient was taken to the OR. Is that something that's either a procedure or a diagnosis or important to the case? No, because obviously they took her to the OR. And bilateral simple mastectomy was performed. So we're going to write that down. Bilateral simple mastectomy is a procedure, isn't it? So we're going to write that down. Okay. Patient recovered with no problems. Pathology report showed no evidence of malignancy. Is that important to the case? Yes, it is, that there is no evidence of malignancy. No evidence of malignancy. Okay? So now we have gone through everything here in this case, right? Okay, so now let's look at the final diagnosis. Final diagnosis, family history of breast cancer. Do we have that down here in our list? Yes, we do. So let's cross it off. Now we have severe fibrocystic disease. Do we have that down here? Yes, we do. Let's cross it off. Procedure, bilateral simple mastectomy. Do we have that here? Yes, we do. Let's cross it off. Okay? So now we've gone through everything in our case scenario. So now let's look at these. Okay? If we look at procedure, for instance, bilateral simple mastectomy, is that not the same thing as a breast removal? It is. So we're going to cross off breast removal. Now, let's look at the fact that it was prophylactic right here. Okay? Is that important for us to know? And can we code that in the procedure? That is not something that is a procedural code. That is going to be a diagnosis code. If we do something prophylactically, that means we're doing it to stave off or head something else off at the pass so that it doesn't happen. In this instance, we're removing her breasts prophylactically in an effort to keep her from developing breast cancer, which she may or may not. But this is kind of a big thing now. If there's a very strong history with a lot of women, they're opting to do this. So we're going to take this prophylactic and we're going to move it over here. Prophylactic procedure. Now that's going to come into play in a few minutes, and that's going to be pretty important because now we have to pick out our principal diagnosis. And if we talk about our principal diagnosis, what is our definition? Our definition of principal diagnosis is the condition that's been established after study to be the reason that the patient was admitted to the hospital for care. Now, when we look at these, was this individual admitted to the hospital because she has a family history of breast cancer? No, because that's not something that we treat, okay? Was she admitted for fibrocystic breast disease? No. Even though we did a bilateral simple mastectomy, that is not a typical procedure that's done for fibrocystic breast disease, which is just lumpy breast tissue. Typically, you just live with it, all right? She wasn't admitted for malignancy. What was she admitted for? She was admitted simply to have a prophylactic procedure done, okay? So, our principal diagnosis is going to be the prophylactic procedure. That's our number one diagnosis. Now, had they found a malignancy, then that malignancy would become the principal procedure, or the principal diagnosis, I'm sorry, because they would have found that the condition after study was that she was admitted because she had cancer, okay? But right now, prophylactic procedure is her principal diagnosis, all right? So now, we've got all of our information. Now we've got to start coding it, all right? So, let's get our books. And the first thing we're going to look for is prophylactic procedure, okay? So, let's go ahead. Now this is going to get a little wonky, so if you have a tendency to get seasick, don't watch me while I do this because it does sometimes make people a little motion sick. All right, so I want you to go to our the main term here, prophylactic, okay, in your index. Okay, so let's go to prophylactic. Okay, and if we look here, and it's handy to use an index card when you're first starting out because you don't miss anything, okay? All right, so prophylactic, here we go. Prophylactic, so under prophylactic we have several things, right? And what are we looking for? We're looking for prophylactic removal of the breast. So if we start looking, is that administration of? No, we're not administering anything. Organ removal. Are we doing organ removal? Yes, we are. We are removing a breast. and two actually, and we're doing it for neoplasia management, meaning when you see this in your non-essential modifiers, it means that somebody has a history of it, and we're doing it so that this person doesn't get it. All right, so let's keep looking down here. What do you know? Breast. Organ removal, breast. So prophylactic organ removal of the breast. Let's make sure that there's nothing else under there that's kind of going down the ski slope, and there's not. So this is where we stop. So we're going to look at Z40.01. Okay? And I just write it down so that I have it. And I don't have to go back to my index if I forget it. So let's go to our Z codes in the back of our book. Okay? And we're going to go to Z40.01. So if we look at this, Z40 is the encounter for prophylactic surgery. That's what she actually came in for, was the prophylactic surgery. There was nothing else wrong with her that warranted an admission to the hospital. Nothing. Just the fact that she was coming in to have prophylactic surgery done. Okay? So she has an encounter for prophylactic surgery. Now we're going to start reading. And you need to start reading here. I don't want you to go directly to the code because you might miss something up here. And that's what coding is all about. All right, so you're going to go to encounter for prophylactic surgery. She has there's an excludes one notation here. And what is that telling us? That's telling us that you will not find these things here, right? You don't code them here. So for organ donations, we don't code organ donations here. And therapeutic organ removal, we don't, because this is not therapeutic, this is prophylactic. Therapeutic is treating something. Prophylactic is doing it before it happens. Okay? All right, so if you keep going down, we're in the right place so far. So we want to go to Z40.0, which is encounter for prophylactic surgery for risk factors related to malignant neoplasms. That's what we've got going on here, right? She's got a high risk factor of breast cancer because it's such a strong, it has such a strong family history. So we're going to keep going. Admission for prophylactic organ removal. Now it's giving us some more notations, right? Use an additional code to identify the risk factor. Well, what's the risk factor going to be in this case? It's going to be your family history of breast cancer, right? So that's telling us right there that the family history of breast cancer cannot be the principal diagnosis. So we're going to keep moving. And here's our Z40.01. Encounter for prophylactic removal of breast. Is that what we have? Sure is. So let's go ahead and put that down here. So her first code is going to be Z40.01. Okay? That's her principal. All right? So we've got that coded. So now we need to code the additional family history. So let's go back to our index, and we're going to go to our main term, which is what? History. Good. All right, so let's go to history. Now, when you get to history, you need to be careful because history is divided into two parts. History is divided into family history, and then if you keep going, you will find that later on, it divides down into personal history. So you need to make sure that you're not, if you need to be in family, you need to make sure you're in family. If you need to be in personal, you need to make sure you're in personal. In this instance, we need to be in the family history section. So, what do we have a family history of? Well, we have a family history of breast cancer. So let's look for our main term, which in that instance would be cancer, correct? So let's look for that, okay? And do we find, let's move this a little bit so you can see. All right, so history, family. We're going to start looking down here. There's blindness and then it jumps to cardiac. So they don't have cancer listed. So what's another way for us to say cancer? And in the medical field, we say malignant neoplasm or neoplasm. In this instance, when we're talking cancer, we're talking malignant neoplasm. So let's go back over here to the next column and let's start looking for malignant neoplasm, and sure enough, there it is. And it's saying malignant neoplasm of, and we know it's of the breast. So that gives us Z80.3, okay? So now let's go back to our Z codes and look up Z80.3. And again, we're going to start up here at the top. Here's our Z80, right? There's no other additional notations or notes for us to read, correct? So we want Z80.3. There it is. Z80.3, family history of malignant neoplasm of the breast. Conditions classifiable to C50 point dash. Now, what that means is that if someone in her family had a condition, had breast cancer, and it was classifiable to this when they had it, this is what it was coded to, then this is the correct thing to use, the correct code to use for her family history code. All right, and since these are the breast cancer codes, this is correct. So Z80.3 is going to be a secondary code. Okay, so now we've got the family history code done. But now she also has her own diagnosis of fibrocystic breast disease. So now we've got to go look at fibrocystic breast disease. So let's go back to our index and let's look up fibrocystic. Okay. Okay. So when we look up fibrocystic, okay, it says disease, which is what we have, fibrocystic disease. See also fibrosis cystic. Now, we could go there, but let's keep looking down to make sure that nothing else skis down that ski slope there, and it does. Breast. And what does it say to us there? It says C mastopathy cystic. Now, if we were to go to fibrosis cystic and went to breast, it's going to send us to this same place. It's going to send us to mastopathy cystic. All right? So, many times you'll have the same disease referenced in several different places. This is one instance. So, we're going to go to mastopathy cystic in our index. And it's going to, here we go right here, mastopathy. And we're going to look for breast, right? Because that's where it told us to go. Well, we don't really have that, right? I don't see breast, but what I do see is cystic. So we've got mastopathy cystic with epithelial proliferation. Do we have that? No, it does not say that. There's nothing to indicate that in the record. So we're going to go with N60.1. Okay, so let's go back to our tabular and go to N60. N60. Okay. N60, benign mammary dysplasia, which is what we have, benign lumpiness of the breast. It includes fibrocystic mastopathy, which is what we have. Okay. And we want to go to N60.1. N60.1, diffuse cystic mastopathy. Cystic breast, fibrocystic disease of the breast, which is exactly what we have. Fibrocystic disease of the breast. It excludes diffuse cystic mastopathy with epithelial proliferation, which we've already talked about. We knew it was going to tell us this, but it's just a way to give you an extra little, don't go here, okay? But if you look, now we have an additional character, and if you look at this little stop sign, that's telling us down here that we have an additional character. So if we see this, we know there's going to be another digit to add on. And what is our additional character identifying? which breast. Now, if you look, there is not a code for bilateral. So what's our guideline? That we use both codes to identify both breasts individually. So we have to code N60.11 and we have to code N60.12. This is the right breast, this is the left breast, okay? So now we've got that. We don't need to code the no evidence of malignancy. So these are our diagnosis codes. Now we've got to code our simple mastectomy. So let's go ahead and bust out our PCS flip bits, okay? So what are we doing? We are taking out some or all of a body part, are we not? We're getting rid of 2 body parts, in fact. So let's look at these. Are we cutting out or off without replacement a portion of a body part? No. Are we cutting out or off without replacement all of a body part? Yes, we are. We're removing both breasts. So we know that our root operation is going to be resection. So that's going to be our main term that we look for. So let's look up resection here. And you can certainly use your little worksheets if you want, okay? So we're going to go to resection. Okay. And what are we resecting? Here's a resection. Okay. Okay, right here. Here's resection. And what are we resecting? We're resecting the breast. So let's look for breast. There's breast. Now, let's ski down our slope. And look at that. We have bilateral. And then it goes down to left and right. All right. Now, we are doing bilateral, we know. Now, many times, remember, most of the time you get 3 to 4 letters to or characters to identify your table. In this particular instance, it's giving us the whole thing. So let's just go ahead and write down 0HTV0ZZ. But we want to go double check it just to make sure. So let's double check it. So let's go to 0H in our tables. Zero HT. Okay. Here is 0HT. So we've got 0HTV. My light went off there. Let me see if I can get it back up right there. Okay, that's good. 0HTV. So we are dealing with skin and breast. It is a resection, and V is bilateral breast. That's our body part. That's correct, isn't it? 0, it's got to be an open approach. There's no way you can do that endoscopically or percutaneously. And there's no device and no qualifier. So our procedure code is going to be 0HTV0ZZ. Okay? So our codes for this particular case are Z40.01, Z80.3, N60.11, N60.12, and our procedure code is 0HTV0ZZ. All right, I hope that helped. It's not as difficult as it seems. Once you do it a couple times with these, you'll be all right. But you've got to make sure that you write everything down. Just write everything down. And then go back. If you have duplicates, cross off the duplicates. Work from there. Don't try to work from here and underline things and highlight them and go back. Don't try to do that. You'll get yourself in a big mess. Write everything down first and then start crossing things off. Okay? And you apply the same principles to your case studies. All right? If you have any questions, let me know.